Welcome back to Nashville Neck and Back. I am Dr. Roberts. I'm pretty excited about today's reaction video. I've scoured through this channel. This doctor's videos are pretty long. His treatments seem to be very thorough. So I think you're going to get to see some things that you've probably never seen before. So anyway, without further ado, let's dive right into today's reaction video. Let's take a look. So this channel actually showed up on my homepage, on my requested feed, and I'm glad that it did because I've never seen this channel before. I've never seen this chiropractor before. A lot of my recommended videos are just the same old stuff, same old channels over and over and over. This one popped up and I was like, hey, it's different. Let me go take a look. I was expecting to click on the channel and just see, you know, a few subs, not many views on the videos, just simply because it had never popped up before. But as we take a look at this channel, this is Dr. Neslie Clerge. He is a chiropractor, 136,000 subs. So a pretty good YouTube channel here. If we click here, you can read all about him. Does it say where he's at? I don't believe so. Anyway, here's all of his Instagram and TikToks and all that stuff. You can pause it and take a look there, or I will link it below. There's his phone number, 202. Not sure where that's from. But anyway, if we take a look here, we scroll down his videos, 55 minutes, 23 minutes, some are short, 20, 42. But most of his videos are pretty long, pretty thorough. It seems to incorporate a lot of stretching and a lot of massage. Popular, he's got 1.5 million, 1.4 million. So no stranger to the YouTube. It does quite well. So we're going to take a look at Dr. Clerge here. And the video that we're going to take a look at right here is actually him treating his wife. And I picked this one, number one, because the thumbnail was hilarious. And actually that's, I think, the thumbnail that popped up that made me click on this channel. But I was like, well, nobody else on this channel is going to get as good of treatment or as much attention as his wife. So let's take a look at that one. It should be pretty thorough to see what all he does. Title of the video, Wife Gets the Ultimate Stretch, Back Crack and Massage Combo. So let's jump right in and see what Dr. Clerge is all about.
Everything hurts.
Like my back. Oh, do you know my hamstring? What I could do for that? Oh, what about my feet? What about?
Every day. Every day.
Every night.
Oh, you got the
Can
memo.
you rub
Nice
on
color
this
stuff.
area right here? Because
Might
it's
even
tight.
be the same brand.
And as soon as it's fixed, I go skate again, and then
Yeah,
it
it is.
hurts
yeah,
all
of
over
course,
again.
yeah, because you know
Cherokee.
you go back to your regular routine. Okay, so like, what's going on?
Again, everything hurts.
All right.
Pick where you want to be.
All right, so we're gonna do. I'm gonna assess you.
So first of all, before we dive into this, I will have to say this. We were warned of this in chiropractic college by more than one professor. Family members, especially spouses, wives, husbands, whatever, are the worst patients. So much so that almost every teacher, chiropractor in chiropractic college highly recommended you to not treat your family. Like if they needed to see a chiropractor, if they needed an adjustment, send them down the road to somebody that you trust to take care of them, because just that there's too much crossover. There's too much that can block your judgment. There's too much that maybe they assume that you should know, so they don't. It's just, it gets messy. They're just not good patients. They're terrible patients, and they know that. But anyway,
So since everything,
and you
hurt, we'll
chiropractor,
probably
any
do
chiropractor
everything,
out there
right?
watching,
because you have like a
any chiropractor out there watching my reaction video, if you know that to be true, leave a comment below and back me up on that.
skating thing today at 5.
Yes, but from here to my toes for the past week have been.
Okay, so it's not really top anymore. Well, is it still?
At the but we're talking, what's the worst?
What's the worst? So from here down to the bottom is bad, and then from here up top is not so bad, right? Okay. All right.
It's probably bad. It's just what I can feel the
What
most.
you can feel the most, right? Well, you're skating, so you know you're always doing all this stuff, right? Remember you had me doing this stuff at the house?
You should have seen it.
I kept my balance though. You did
He did a very good job, but it was quite funny. I don't know if figure skating is in his future.
Okay. All right. So, well, your hair's all wet and stuff.
My apologies.
So I'm gonna start from lower and then go up. Okay.
Okay.
So let's apply pressure. Is that okay?
What's the What's the meaning of okay?
Like, what do you feel when I'm palpating?
It's okay.
It's okay? Okay, but no pain with applied pressure to your lumbars, right?
No.
Okay.
Whew,
All right, you
Doc,
ready?
be careful, man. I would just make a recommendation. And again, this guy's been on YouTube for a while. Be careful with how you're
Like, what do you
filming.
feel when I'm palpating?
It's okay.
It's okay?
go
Okay, but
back.
no pain
You can see that's his personal desk in the background, which is fine.
with applied
But
pressure
as
to
the
your
camera
lumbars, right?
rotates, I mean, that could be potential private information, patient information, personal information, whatever. I would just be careful of that.
Okay. All right, you ready? Your rotation actually pretty good.
Just a little.
Just a
tight
little
here.
bit, but nothing major, right? Okay. What's going on with that?
That's fine. I
That's
think
fine?
because this is the side, I'm used to going this
It's
way.
doing this way. Okay. All right. I'm gonna bring you back.
Huh.
What's going on with that?
I felt all of
You
it.
felt all of that. Okay. All right. So your hair's all wet. I'm gonna go side to side.
So when he's bringing her back, that's a form. Preferably the patient would be standing, and he may have just been doing a range of motion. But when you bring somebody back like that, and that generates pain in the lumbar area, what you're doing, it's a positive Kemp's test, and you're jamming up those facet joints that should be gliding like that. And when you bring somebody back like that and it's painful, that's usually the source of the discomfort,
Side, okay?
as opposed to a disc.
You locked like right here. Is that painful? Is that sore? Is that stiff?
I think my neck is used to not moving.
Not moving. Okay. Is that sore, stiff?
Stiff.
Stiff. Okay. That's okay.
Yeah, it's all stiff.
It's all stiff. Okay, but your motion is actually pretty good.
Okay.
Okay, all right, so we're gonna focus on the lower portion. That's where most of your issues are for now, right?
Okay.
Let's have you stand up for me. All right, so let's have you bend forward for me.
And I can
Sure.
tell you ahead of time, my calves hurt,
Okay,
my hamstrings hurt,
okay,
my quads hurt,
okay.
my shins hurt,
Well, the thing
my
is,
ankles hurt.
Shaquan, when she does her part,
Okay.
she starts on your, you're gonna be on your stomach, and then she starts with applying pressure.
Oh, my-
So she's actually putting her body weight on your
Okay.
calf muscle, your
Okay.
hamstrings. So let's have you bend forward. Try and touch both feet. Let me know what's going on. Is that fine? Is that okay?
That's fine.
Okay, let's have you come back up.
Should I go to my range?
Yeah, whatever range. Yeah, sure. Whatever range is good for you.
See here,
Uh-huh.
I
got
start
good
to feel
flexibility.
it.
Okay.
Oh, in there.
Okay. And then you wanted to also do like that extension, like you were telling me this morning, right?
I want to be able to bend at the hips and not just in the back.
I see.
Like I want
Yeah.
more,
Is that for like a skating move or something?
yes,
Okay.
a layback spin. So
Okay.
I have to be here,
Okay.
here, and like, see, I'm using my upper back and I need to bend from here.
Okay. All right. So basically, what I'm assessing is like any asymmetry between your shoulders, hips. Go very slow for me. Yeah. Okay. And then go back around. Do you use one side compared to the other when you skate?
Yes.
Which side? Okay, well, don't tell me yet. Do you use your right side more?
Yes.
Okay, all right. Let's have you face the mirror for me. Okay, so you use your right side more. Now, just looking at the mirror, which side that you see that's a little bit higher than compared to the other? Like, put just
Oh.
both hands down on your shoulders. Do you notice one side is lower? You don't? Do you notice that this side is a little bit lower compared to this side, now that I mention it? You don't see that? Okay.
See what I mean?
All right,
Terrible
so
patience.
It's very slight, though.
Okay.
Okay, so let's
I see it more down here.
Right, yeah, the hip, right? This tend to like sits higher compared to the right side.
Yeah, and
Yeah.
this one is out more.
Yeah,
than
yeah,
this
yeah.
one.
And then the same thing for the shoulder. It's slight, but this is just slightly higher compared to
Okay.
the other. Okay, now I don't know if Do you wear your purse on the right side, or if it's because all that
I do.
extra?
I wear my purse on this side.
Right. Okay. Now bring both arms up like this. Bring both legs out. Both legs. Good. Okay. All right. Good. Let's take a look at the hips. Lift this leg up for me a little bit.
How?
Like this.
From this, I can't from.
You can't. I mean, you're a skater. You should have enough balance, right, to do that.
No,
Right?
because my legs are too far apart.
I could do it.
You see?
Like this, and then I'm holding you.
See what I mean? Any other patient he tells that to is going to do exactly what he says. But his wife is going to give him grief. I feel you, Doc. If you happen to watch my reaction video, I feel you. I know what you're going through.
Just do this. Like that.
Oh, like this.
Right.
Oh.
You can do that.
Okay.
All right, let's bring
Or
them apart.
it can be the doctor's fault. It could be maybe he didn't describe that well enough. Not placing blame. I'm just saying it goes both ways. Spouses are terrible patients.
A little bit wider. Okay, now try and lift that hip. Okay, same thing on the other side. Okay, is one easier to do than the
Yes,
other?
this has been my biggest issue. It's driving me insane. I think this hip is further back than this one. Like
Okay.
it feels like this one's more forward
Okay.
and this one's more back, and I have to cross this way.
Well, that could just be like a usage thing, right? Like if you're overusing one side.
I think I've always been that way.
Yeah,
Even when
so
I
one side's
cross
gonna
my
be-
legs, I can't cross this way, but I can cross this way.
So if you're always using the right side is going to be stronger compared to the left side. So if you
Not a strength thing, a rotation
like
thing.
a motion thing.
Yeah, like I have to do like this. That's really difficult on this side. It's really easy on this side.
Okay. All right. So let's have you face down on the table. No pain with what I'm doing, right?
No.
You feel it already? Is this painful?
No.
I'm gonna keep the pressure. Lift this whole leg off the table. Lift it as high as you can. High. And bring it down. Same thing on the other side. High as you can. Bring it down. Okay. All right, let's do it by yourself without me adding pressure. Do this side. Okay, do the other side. Okay. So your left side is going. Do you feel it? Left side is going high?
Left side, I can go back higher.
Okay.
And forward, I can go forward. But
Okay.
this one is better than this one.
Than this one. So you have more extension with the left side compared to the
Backward.
right side, right?
And going back.
Back, right, extension, yeah, going back. Okay. All right, let's have you sit back up. We'll start with the adjustments first, and then after that, I'll stretch just to kind of loosen up, like your right side, left side of the hip.
This hip
Yeah.
is on a whole nother level.
Because you have a 5 o'clock session today too, right? Okay. All right. Okay. So let's go back to the room.
Oh, so when we jump, I land on this foot, rotate and then land, and then that's why it's always this side. But like this is always sore over here.
Okay. Are you allowed to wear like a knee brace or allowed to wear some type of bracing while you're practicing? I'm sure during competition you can't, right? Yeah, you should wear a brace because if you're going to be, my knees are bad. So if you're going to be doing all of this, that's a lot of pressure on your knees. So the brace at least will keep it or provide some type of stability for you.
I mean, it doesn't hurt like it used to.
Okay.
It's just, I didn't know if it was too much twisting.
Yeah. But the thing is, you lost weight too, so that helps as far as not putting a lot of pressure on the knee. I'm sure you've noticed a difference.
And
202
I stretched
Washington,
these
D.C.
because they were pulling
So I guess they're
on my
located in
knees.
Washington.
On your knees, okay. So yeah, we'll do all that today.
Okay.
All right, let's go back. Oh, you're gonna get me all wet.
Yep.
What is that, water?
Water.
Okay, good. All right. Take a deep breath for me. Let it out. One more time. One big breath. Out. Ooh, that was good.
Yeah.
That
Needed
was
that.
So again, you see some docs doing that. I've never seen a chiropractor do it back to back. You've probably anyway seen a lot of docs on YouTube. They'll do that and they'll come up like in a full Nelson move and they'll lift up with the patient seated like that to get that distraction on the thoracic and even some of the lumbar spine. Personally, just not a fan of that. I mean, you do that all day with all your patients. That's just putting a lot of extra stress on your own back, and you're just going to wear your body out, man. I don't like watching other chiropractors do that, because to me, it's not that it's not effective. I'm not saying anything like that. It's just, to me, you're putting your own body at too much risk. And I mean, all it takes is you throw your own back out or hurt yourself, and then what are you going to do? You know, who's going to run your office?
Now I'm gonna go mess all of this up.
Yeah, and I'm not working tonight either. So I'm gonna get everything we can do for you today. All right, any pain with that?
No.
That's fine. Go ahead, take a deep breath for me. Let it out. Good. Okay, that's good. All right, I'm gonna do your neck while you face down, okay?
Okay.
All right, so just relax for me. Good, let it go.
Ow.
Let's go to the other side. Was that painful?
Your hand dug in my...
Oh, yeah, my hand. All right, relax. Ooh.
Gee.
Yes, that was good.
Wow.
Mm-hmm.
Oh my gosh.
Come on, let's have you sit up.
I can't move.
That was good. They got everything. How did that feel?
I guess I can move my neck.
Yeah, you know there's a difference already, right? Yeah.
Oh.
Not too bad?
Mm-mm.
Okay. All right, let's do your lower back. A little closer, a little closer. There we go. Make this leg straight. Good. Take a deep
See,
breath.
even there, you're a chiropractor's wife. He's probably adjusted her a million times. If not, she's been adjusted probably by other chiropractors. And he still has to move her around and get her in the proper position. I should do a video one time of patients in the office, or I think I've seen some funny videos about patient position, especially this move, side posture, lumbar. Patients never get it right. You got to move their legs, you got to move their arms, you got to reposition them. And even this, a chiropractor's wife, even at home, when I'm adjusting my wife, it's always just, it's like herding cats or
Let it out. Ooh, sheesh. Let's go to the other side. Deep breath. Let it out. Relax. There we go. Good. Okay. Let's have you sit up.
I just want to take a nap.
Good. Any pain? No? Okay. Okay. So when I tell you slowly move it back slowly. There we go. Good.
I thought it was going to be a big action.
Nah, I mean it's just a little pop. You expect like a back crack?
That was a disappointing crack.
It's not gonna be a big pop. It's your shoulder. Let's do this side. All right, I'll tell you when to move it back. Slowly move it back. There we go. Good. What? You wanted a bigger crack? It's a tiny crack. You want like a big.
I mean, it's
It's your shoulder. It's not your spine.
I mean, I don't know.
So yeah, like the gases don't escape because as far because gases are escaping from the joints. That's the fluid that's around the joint.
Okay.
Like when you open a soda bottle.
Shoulder gaps versus
So it's not gonna be a big crack.
gas versus shoulder gas. I don't.
All right. You want to put some lotion on them?
Let's leave them on.
You didn't do your toes?
No, I never do my toes. They're just skate.
Just relax. Your toes don't pop like everybody else. Let's go to this side here.
Maybe they're too small. I have very short toes.
Yeah, very short toes. There we go. Got a little pop.
Can you make my ankles more flexible?
We're gonna stretch the ankles, work on your feet as well when you're at the table. Okay. Just relax. Good. Okay.
This is a lot of manhandling.
That's how you sit up. All right, so let's work on stretching because I know your time is limited. So come on back.
My toes were like, oh, we never moved that way.
You can come closer if you want. Your foot is just so ashy.
I told you. I told you that before we started. I forgot to put lotion on when I got out the shower.
You can't see it in the camera.
You sure can. The YouTube people are gonna talk about you.
He's about to get kicked.
I
Better
told
watch
you I
out.
wanted to put some lotion on. Can we edit out the ash?
Yeah, I don't think we can do that. I don't think we can make your
I told you
skin
before we
glow.
sat down. I was like, my feet are ashy. Can I put lotion on? You were like, no, I'm gonna put lotion on when we do the thing.
Especially this part.
That's what I was talking about.
Like you were in a cotton field.
No, flour, not cotton. See, you can't even get your cracks right.
It's not cotton?
Flour.
Oh, okay. You were beating flour or something?
Stomping in flour.
Stomping in flour? Oh, man. What about cotton? Does cotton make you happy?
No.
It doesn't? See, I don't know. Well, it's too late now. We're already working with the ash.
Well, it is what it is.
They're gonna be like, why are your feet so ashy?
Well, sorry, YouTube. I got some lotion in my purse, but he told me. He probably did this on purpose.
You can put a lot of pressure on her.
My calves. Oh. I tried to do it myself last night. It wasn't working. Now that's amazing. Oh, my lower back thanks you. Oh my goodness. I didn't know it was this bad. Oh man. This is made for people with butts like mine. Because you can never feel it. You know, oh gosh.
All right, you gonna grab onto my arms. Take a deep breath. And let it out.
Little surfboard move.
Try and relax. You're making faces and stuff.
That was what it felt like.
Breathe in. And let it out.
To me, that looks terribly painful just from a shoulder aspect. Personally, I have
That was
two
rough.
terrible
My
shoulders.
back is not
And to
flexible.
Well, that's what's
pull
gonna
them
get
back like that
flexible
and have
is
that
you
much
wanna
tension and stress.
Do all this extra.
Does not look like fun. I'm sure it feels good to her. She's probably
Take a
got
deep
better
breath.
shoulder mobility than I
And let
do.
it out.
Ooh.
Take a deep breath.
Oh my.
And let it go.
She's about to roll off the table.
Her pants are silky.
Try this again.
I didn't know what to expect.
We're gonna try that again. Take a deep breath and let it go.
Oh,
I don't know why her leg keep coming up.
that's what's supposed.
We're gonna try that this
What
one.
is it supposed to do?
You're supposed to fill it up in here.
Oh, I mean, I felt it, but my leg was supposed to stay down.
It's supposed to stay right here. Take a deep breath. And let it out.
Easier on that side.
All right, we're gonna do that again.
Let's get the hamstring.
She's super flexible.
How was that? Nice,
It
nice,
clicked.
nice little pop there, huh?
It was much better than the shoulder.
Yeah. No, didn't the shoulder adjustment?
I remember the word. The shoulder was very anticlimactic.
You expect like a super big pop. A little bit of a small pop there.
That was a click. It wasn't even a pop.
You've gotten more flexible.
I told you something in this hip yesterday. Finally released. It was so tight. And it would hurt right here.
Mm-hmm.
Okay, so let's talk about this.
You're about to yank her off the table.
You, huh?
I've been practicing this one move and this leg is just so tight.
I know. I can feel it. Relax.
So he's making this look super easy. This is the thumbnail.
You're going super fast.
Oh, sorry. She's in a hurry.
It's okay.
He's making this look super. She's super flexible. I can't imagine trying to do some of this stuff
Let me know when it's too much for you.
with a normal patient. By normal, I mean somebody who's like not flexible at all. You would not be able to do this.
Keep going.
Yes.
Oh, I felt like I was gonna flip over.
Relax.
They would stop at like 60 degrees or 90, like right there.
Y'all keep saying relax. These aren't relaxing positions.
Right.
Goodness sakes.
Good. There we go. There we go.
Yeah, 90% of patients aren't going to be able to do that.
Good. Good. Deep breath. Let it out. Good.
Is anybody falling off this table?
Nope.
I don't want to be the first.
Hold on to that table. You're not gonna fall. Deep breath. Let it go. Good. Deep breath for me. Let it go. There we go. Good. Deep breath. Let it go. Relax.
That's a good one. Mm-hmm. Let's try that one again.
Go. Deep breath. Let it Deep breath. Let it out. Good. Switch arms. Relax. Deep breath. There we go. Good. Let's go again. Good.
So like if you trip, then we're both going down.
I'm not gonna trip. Relax. Deep breath. Out. Good.
I feel like this needs to be done 5 times a day.
Yeah. Get those skating hips.
It's like counterproductive. Like you get stronger, but then you're too tight.
Right,
Like,
right,
watch your knees.
right. Give me this hand. Give me this hand. Deep breath. Let it out.
Your knee cracks.
So damn goofy.
Do I get to charge you for that?
So goofy. Deep breath.
So I'm curious, like
Relax, relax. Drop your
non-YouTube,
relax.
if he
There you go.
spends this much time and does all this stretching work with every single
more time.
patient,
Deep breath.
I'm guessing it's the other girl that was doing the stretching before or massage.
There we go.
Oh my goodness.
Yes.
And
That lower
otherwise,
back.
he would be
She told you it's about to get serious.
very limited with the number of patients he could see today. Spending this much
I
time
need
with each
a nap
patient,
before this thing is over.
doing not only the
stay
chiropractic
in the
but the
middle.
stretching as well,
There we go.
which is very thorough, and I'm sure the patients that need it love it. Man,
Complicated.
I mean, it would be like 6 or 7 patients would all you'd have time
Well, I
for.
guess we get
in a
used
day.
to it.
His hip is moving a little better.
Mm-hmm. Give me this hand. Let it out. Deep breath. Out. Deep breath. Let it out. Yes.
That other side was worse.
It's not as tight as the other side. Yeah. All right, Shaquan's gonna take over.
This is like a tag team with both hands.
With this hand. Right?
Mm-hmm.
All right. No, you don't need both hands. Take a deep breath.
Ooh, yes, I do. That one hurts. My hamstrings are so tight, and whatever these are called, hip flexors.
Breathe in and release. Breathe in and let it out. Take a deep breath and let it out.
Goodness sakes.
Breathe in and release.
She's insanely flexible. Man, hardly any normal patient would be able to do, at least not to this extreme.
This is not a move where you want a camera in your face.
What?
This is not one of those moves where you want a camera in your face.
And then your leg come back with me. Take a deep breath and let it out.
See, this is the good leg. That other leg.
Breathe in. All right. You're gonna grab onto the table. Take a deep breath.
Really digging in that hamstring. Alright, where we got here? So we're still got 12 minutes to go.
That's amazing.
All right.
Take a deep breath. Let it out. Good. One more time, deep breath. Let it go. Perfect. Relax, deep breath. Out. Deep breath. Out. Good. Perfect. Okay.
I can move better. That doesn't hurt as much. Feel good.
Not too bad.
Whew. I got a new back, a different back.
Different back. So now we're gonna focus on the muscle. So I'll start and do a little bit of like myofascial release, hip, lower back. Because I know you
Okay.
gotta get moving. All right.
All right, so we'll skip through this. I'm sure it's fine, but you know how YouTube can be. So he's doing some myofascial release, like I said, some massage, some muscle work. And it looks like...
Other side,
Nope,
right
he doesn't. I
side
thought he
is
was going to
worse,
switch
so.
out to that other lady. But anyway, let's go back here. I'll just pause it right here. Yeah, so first impression of Dr. Nestle. Good stuff. His adjustments were top notch. I like the fact that he had the therapist in there with him, or the massage therapist, kind of going in between the adjustments and the stretching, and then doing an adjustment, and then some more stretching, and then some muscle work, and then a little bit of massage, and then some more stretching. So it seems like if you scour through his YouTube channel, that is a good sample of what he does on a day-to-day basis. So it seems like the patients do get a lot of time. I would only assume that if he takes insurance, that he's got a way to bill all of that, or he may be completely self-pay, where the patients maybe pay a little bit more for that extra time. Because, you know, if you're getting, I don't know, 5-10 minutes of chiropractic time with the chiropractor, and then you're on top of that, you're getting another 20 minutes of stretching, and then on top of that, you're getting another 20, 30, 40 minutes of massage. I mean, that's a good chunk of time that can't be cheap, because you're not going to be able to see that many patients a day if you're spending that much time with each patient. But regardless of all that, video is good, content's good, quality's good. The whole chiropractic itself was good. Like I said, I really like the back and forth. So overall, pretty impressed. I like that channel. If you guys know any other of his videos that are like kooky, crazy adjustments, crazy stretches, or just funny, send those over to me. In the meantime, make sure to go over to Dr. Nestle's page and give him a follow. Watch some of his content. And yeah, thank you guys for watching. Make sure to check out some of these other videos that I link up here, and we'll see you in the next video.